Good morning and welcome to the second Digital Health Summit, and thank you for joining us. My name is Bleddyn Rees and I'm the chair of the Digital Health Society. I'd like to start with my introductions, talk about three things: a bit of background to the Digital Health Society and this summit, so what, and secondly, some housekeeping. But to start with, some background to the Digital Health Society. The Digital Health Society was a movement born in and a legacy of the Estonian presidency of the Council of the European Union in 2017, which was focused on the development of the digital society in Europe, enabled by the free flow of health data. I'd like to acknowledge the substantial work that was done by Amy Vasco, who was then in the Estonian government, and some colleagues of mine, Julian Venn and Brian O'Connor. In December 2019, under the patronage of the Finnish presidency of the Council of the European Union, DHS convened its first Digital Health Society Summit, connecting digital health and data initiatives in Europe. It was clear that many data initiatives were underway, but there was a need for greater collaboration and coordination if these initiatives were to scale and known challenges were to be solved. At the first DHS Summit, we collaborated with the European Institute of Innovation through Health Data, and together we planned a series of roundtables to continue our work and contribute to the debate about the European Commission's plans for a European health data space. The second DHS Summit will present the draft conclusions of our roundtables on acceptance criteria for societal trust in the use of health data, and a recipe for trustworthy digital health, standards, architecture, and value. I would like to thank our summit sponsors, Johnson & Johnson and Microsoft, and Better and NeedleSmart, and our content sponsors, All Policies for a Healthy Europe, Digital Health Europe, I2M, and Smart Work. So, turning to the so what question I pose, health data has never been more important than in a pandemic. It's almost impossible to miss the television constant references to the R number, infection and death rates, and neither has research analytics or predictive analytics had greater exposure. The need to learn in real time from health data across borders has also been striking. Hospitals have been helping each other on treatment pathways, treatment options, and the effectiveness of various drugs. The European Commission is developing important policies for its next term, and for us, the European health data space is the flagship policy which must be successful. This summit is our opportunity to positively contribute to the development of the European health data space. The ECH Alliance International Ecosystem Network is the delivery vehicle to implement policy and innovation, and now has over 50 ecosystems transferring best practices and lessons learned from one place ecosystem to another, helping to help make health and global care not national silos, avoiding reinventing the wheel. No country or region or continent has a monopoly on innovation, which is why today we are delighted to announce that we have 550 registrations from 55 countries. This reflects the global connector work of the ECH Alliance. The 550 people represent all stakeholders involved in the health and care community, from academics, researchers, universities, hospitals, healthcare professionals, students, governments, ministries of health, NGOs, patient groups, embassies, industry, pharma, telco, tech, medtech, health and care services, ecosystem managers, professional associations, trade bodies, and regulators. We welcome you all. A few matters of housekeeping. Attendees, your microphones are muted, and if you want to ask questions, please use the chat function, and the moderators will try to pick up some of the questions if time permits. If the question is to a specific person, please include their name in the chat box. We also encourage you to use the chat box to share information, links, and documents as you wish. The program has coffee breaks and lunch when the networking appointments will happen. Please take a look at some of the exhibition spaces, which will have a range of good information about digital, data, and digital health, as well as about the summit partners. I hope you enjoy the summit and thank you for attending.